Invisalign Phase 1 appliance is a very good space-gaining appliance. The protocol, the treatment clean check protocol, has been very well designed in doing the expansion, and the optimized attachment that were specifically made for this type of treatment are very effective in retaining the appliance in place, but without undue loosening of the deciduous molars while the patients are taking it out. And the clean check itself, having the clean check at hand, we can actually have good communication with the parents to show them the outcome of treatment. I'm very excited about this product because it presents us with a very good alternative appliance for treating young children. Well, I'm using like 2x4 sectional appliances, removable acrylic appliances, the fixed expansion appliances, and then pendulum appliances. The biggest advantage for using an Invisalign Phase 1 appliance is actually a multi-objective appliance, in that it's able to correct transverse problems and also sagittal problems at the same time. Whereas using the old type of traditional appliances, we're only able to deal mostly with the problems in one dimension. And then the other significant advantage of it is actually the Phase 1 appliance by Invisalign has been very comfortable for patients, for my patients to wear. Because in the old days when we used the old type of appliances, they were very bulky and very uncomfortable for patients to tolerate. I think using Invisalign first, I think we should choose patients that are in their early mixed dentition, around 8 to 9 years old. They should have very good rapport with us. The parents should be very motivated for the children to undergo treatment. We should be looking at cases where there is mild to moderate crowding and a bit of a narrow arch. So that will be very effective for the appliance to actually increase the arch size for those patients. Prevention is better than cure, but many of these early treatment in mixed dentition, we're not able to actually fully cure a problem. But if we don't do anything, the problem is just going to be more complex. So that sometimes early intervention will help to lessen the burden of treatment at a later stage. Well, the parents were very satisfied with the appliance because it didn't give them any type of emergencies where they had to come into the office to have it fixed. And the way we scheduled the appointments, it didn't disrupt their busy schedule. So they didn't have to come in all the time to have the appliance adjusted. So because they could wear the appliance by themselves, they could change the aligners, on their own. So just to keep on to their schedule of wear. So for them, it was a very good experience. The expansion were very efficient and very effective. I've put the patients to wear the appliances at a weekly interval. I thought that it wasn't possible because I wasn't quite sure then that the patient were compliant, that the attachment weren't working well. But having done it, and I've seen it happening, like doing weekly interval where the outcome was very effective. The staging, the protocol was very good too. The way the clean check was designed to stage the expansion. It was very effective in achieving the sort of expansion that we were asking. The other thing that I've noticed is that the attachments were a bit different from the ones that I was using for older patients, like in adults. They were specifically designed for younger children, and they were very retentive. I thought that they were a bit too small, but they were retentive and it didn't cause the deciduous molars to become loose during treatment. If you ask me, I feel that Invisalign First appliance is the best appliance for phase 1 treatment. With the right patient, the right attitude, and the right timing, I'm sure that anyone that's going to use this appliance will be able to achieve very good outcome with it.